Okay, so you're saying
Okay.
standard practice.
Well, standard of care for early stage breast cancer is to either have a mastectomy or a lumpectomy with radiation. There are subsets of patients that don't need radiation, and there are subsets of patients that don't need as much radiation as we had previously been giving. Certain patients with early stage breast cancer can be given a single treatment with the IORT technique during the operative procedure, and this saves them the inconvenience of going through what's called a fractionated course of 16 to 30 treatments, which is standard and has been the standard for a number of years. So there's a great advantage for select patients who have early stage, smaller tumors in which they can get the entire process done in one shot, one stop. And the outcomes are very favorable. The clinical literature supporting this is very impressive. The side effects are less than the standard fractionation because there's literally less volume of breast tissue receiving radiation. And the technique that's been developed is unique in that it's a means of administering radiation to the surface of a cavity where the lump was removed. Then the biggest concern for oncology is preventing recurrence, and the highest probability of recurrence is in that 1 to 1.5 centimeters of tissue surrounding the lumpectomy site. So this is kind of taking the best of all worlds and encompassing, the treatment and rolling it into one package.
In a state like Kansas, which has a whole lot of rural area, how would this be effective or good for a patient?
Well, there has been a tendency for patients to opt for mastectomy when they're in rural areas because they just simply can't make the daily treatment that 16 to 30 fractions that are typically given. So there's a rural population with select tumor characteristics that are ideal for this, where they have to be in the operating room anyway. So this allows them to broaden the horizon for options for treatment. And some of them can elect breast conservation with complete confidence that their reduction in risk of recurrence is there.